How we get other folks involved, we are not bashful. A motto I have is wishing is fine, but asking is faster. So if I think someone can help, I don't really just wait and wish that they would recognize that need and help us. I'm very willing to step out there and have those one-on-one conversations. I'd like to think that it's not just asking, hey, will you give us something? But try to have that conversation where I find out what their goals are and what their needs are and their personal priorities or organizational priorities are. And we see where they can meet, because a lot of times people who have the means don't necessarily have the way to do it. They don't have access to a community. They don't have that social capital. They may have financial capital, but not the social capital. So I meet with those folks, and by that I mean I go to a meeting, probably 2 meetings a day, to find out what's going on with other folks, what their goals are, and how we can align and connect. Some of our greatest supporters, and I'm imagining you're taking this information to share with other markets on where they might look for some resources. But some of our greatest resources have been medical folks in the medical field. There's a strong trend and a need, and there's funding and requirements that medical care providers do more than office visits. So we are willing to do that work on outside their normal space, their normal concrete walls. And not that they haven't been doing it already in lots of places, but there's a moment right now with attention to this, with farmers market attention, that I think that we're capitalizing on and being able to capture that. So medical care providers, first and foremost, Mountain Comprehensive Health Corporation, and but not only them at all. Beyond, we see the Mountain Comp and recognize them as medical care providers, but then beyond them are other levels of folks in medical care who have initiatives, goals, want their name on good things. So the insurance providers, the WellCare, Passport Health, Humana, Anthem. Every county in Kentucky has a worker from each of those organizations that is connected with them. Find out who yours is. And I'm sure there's an easy way to do that, but even if you can't find the easy way, there is a way to do it, to just dig it out and promote the things that you are doing, and they'll dig you out even. That happened with some of those insurance providers, contacted us. We want to be a part of this. We want to give money to this. So how can we be involved? Another group, so medical care providers would be my first folks that I would suggest talking to. After that, universities and your academic audience. University of Kentucky has been fantastic. Of course, we have a partnership already with the Apple Tree Project, Appalachians Together, Restoring the Eating Environment, which is a National Institute of Health grant. But beyond that, we have other support from University of Kentucky, from conversations with Dr. Karff and leadership at University of Kentucky Medical Care, also with University of Kentucky Superfund. So if we are, the walk-in program is pretty simple. You walk to the market and you get $10 to spend. But before that happens, everybody goes to the extension office and everybody gets weighed in and everybody gets measured, and we collect that data, and we have to be, then we're held accountable. We have to be meticulous with our record keeping, but it's not that hard. And also the university provides funding to do that. So someone else has a little bit of an employment opportunity with that.